Awesome. Again, thank you everyone for joining us tonight. My name is Michelle Avila and I am the chair of the Bronx CB7 Health and Human Services Committee. I will pull up the agenda shortly, but we want to read the meeting guidelines. On September 2nd, 2021, Governor Kathy Hochul signed into law Chapter 417 of the laws of 2021, which authorizes the community board to run this meeting remotely, and minutes will be taken for record keeping. The minutes will appear on our website within days and can be requested from the Bronx CB7 staff at any time. If you're calling into the meeting on a conference line, the controls are as follows. You can press ** to hear all of the commands available. *6 mutes or unmutes you, and *9 virtually raises your hand. We will run the meeting as follows. Bronx Community Board 7 has the right to remove and or ask a member of the public to leave a meeting or block participation of anyone who engages in inappropriate conduct, including but not limited to obscene language or offensive images or language, personal attacks, threats, or any behavior that reasonably impedes the orderly administration of the meeting. Repeated offenses will be reviewed by the board's executive committee or any other assigned committee for a ban, the amount of time to be objectively determined by the above committee of the participant in the event of repeated disruptive behavior. If in-person outbursts or attacks continue, this will be considered disturbing the peace and the authorities should be summoned. Everyone besides the speaker or presenter will stay muted throughout the meeting. After each presentation is over, I will inquire if committee members have any questions. Committee members can signify that they have questions by pressing the raise hand button on the screen or requesting to speak through the chat or when the chair opens the floor. Members of the public who have joined the online link will also be able to ask questions and make brief statements on the item after each presentation and after the committee and board members have had an opportunity to ask any clarifying questions. Again, you can do this by pressing the raise hand button on the screen or requesting to speak through the chat or when the chair opens the floor. Only those recognized by the chair of the committee will be allowed to speak during the allotted time. We will stay on topic with agenda items. Any other items will be acknowledged by the chair in new business or addressed at the next meeting, granted there is time and the committee agrees on the topic. Following the question, discussion, and public comment portion, the committee will begin their discussion after each presentation or agenda item and will conclude with the decision to vote on a recommendation if requested. When the agenda is finished, the meeting will be adjourned. If there are any questions related to meeting software or to our process, please use the chat function or raise hand function now or contact the district manager. Thank you all for bearing with me. I'm going to pull up the agenda now. And I want to say that we have a pretty robust agenda tonight. I see a few folks on the line, and so we'll be calling folks as they're listed here. So I'm going to start by calling on attendance. And we did not have a meeting for last month, so we do not have minutes to review. We'll then go into new business. We'll see if there are any representatives from DOHMH, Montefiore. We have a very special presentation from North Central, which I'm very excited and very grateful that we have some folks on the line. Also, we'll give an opportunity for DIFTA and Moya, if they're in attendance, to also talk about any updates in their respective areas. And as I mentioned before, I would love to start discussing as a committee and members of the public kind of outreach efforts for the summer as we prepare to adjourn from community board meetings. So with that, I will ask if anyone from DOHMH is on the line and would like to unmute themselves and share any updates.
Hi, Michelle. Good evening, everyone.
Hi, Kenneth. How are you?
I'm doing well, thanks. So a few updates from the health department. As of yesterday, we moved into COVID alert level high. So for those that aren't familiar, this means that we have both 300 new cases per 100,000 people. And we also have 10 hospitalizations per 100,000 people. And this is in the last 7 days. So along with this, this movement into the high COVID alert level, the commissioner released an advisory yesterday, which basically is strongly encouraging and recommending that everyone who medically can tolerate wearing a mask do so in indoor settings, all indoor settings. And this is in addition to the mandates of the face mask wearing within public transportation. Obviously, you know, we are not an enforcement agency, but these are strong recommendations from the commissioner and the Department of Health. So, you know, we would want to encourage everyone, of course, to, you know, mask up when you are unfamiliar with the vaccine status of the people around you. Of course, you know, staying home from work if you have that privilege and that option. And of course, you know, continuing to get tested if you think you may have been exposed to COVID. And with that, I will post a link into the chat that has some news about news and more explanations about the COVID alert levels, as well as what to do if you test positive for COVID. And lastly, I just want to just, you know, say that, of course, you know, with it getting warmer, with spring and summer coming, the Department of Health is always looking for opportunities to table and, you know, go to any community engagement events. So I'll also put my email in the chat. Please reach out to me, and I'll do my best to either attend myself or arrange for another representative from the Department of Health to attend. We're really looking forward to getting back out in the community and being at these events. Thank you.
Thanks so much, Kenneth. We really appreciate the update. I want to say that we've been kind of monitoring the COVID-19 rates in our own zip codes and neighborhoods, and I was very excited that the alert had gone down, and so I didn't prepare our usual stats for CB7, but seeing as the alert has increased back to high, I will be doing that for the general board meeting just so that we can see how the COVID transmission rates are doing in our zip codes. We absolutely appreciate any and all resources, and we'll be sure to continue sending you information and inviting you to join meetings and any events. So thank you.
Absolutely, thank you. And I'm sorry, just one more point I just remembered. The federal government is doing another round of mailing COVID tests to individuals. So just want to make everyone aware of that. You can sign up to receive them the same way that you did at the previous round a few months ago via the post office website.
Perfect. Thanks so much, Kenneth. And we'll get that link and also share it and send it around our community board newsletter and listserv. I see we have community board member Jean Hill has her hand raised. Jean, go ahead.
Hi, good evening all. Two quick questions. One, are you recommending, Kenneth, the second booster shot? We have started to give the second booster shots where I live to any individual who wants to take it. So is that still a recommendation for people to get that second booster shot? I mean, they've had 3. Some of them say, well, I already had 3 shots, so I really need to get the 4th one. And then my second question is, are there available places you can go to get a rapid PCR test, not a rapid COVID test, but a rapid PCR test? Thank you.
Thank you for both of those questions. So for the first question, in terms of boosters, yes, 100%. I don't remember the current eligibility off the top of my head for the second round of boosters. But if individuals are eligible, we absolutely want to recommend that they go and receive their second booster or first. All of the added protection helps. And the reason for that is, you know, when you get vaccinated and when you get boosted, you have waning immunity is what we call it. And basically your protection is the highest once you are initially vaccinated. And from there, it starts to decrease. So of course, you know, if it's been, I think it's 6 months since your first booster, you would now be eligible for the second booster. And for your second question about the PCR tests, there are COVID testing still happening at some city-run sites, and also through Health and Hospitals Test and Trace. I'll do a quick search and I'll put some information in the chat for those locations as well. Also, there's tons of tents around the city at different intersections. Those are also available to do. Some of them, most of them are rapid tests, but some of them also do PCR tests as well. I don't know, I'm not sure if you have to have insurance to get those tests or how that works. I know a lot of them are free, but absolutely always want to be sure. In addition to that, the health department, Health and Hospitals and some other city agencies are distributing home tests at cultural sites all around the city. So we really don't want people to pay for COVID testing unless it's absolutely necessary. I know that there isn't an abundance of PCR testing available, but of course, there are other resources that we have.
Thank you for that, Kenneth.
Absolutely. Thank you.
Thank you, Kenneth. And thankfully, we have some folks from North Central Bronx whom I hope can give us a quick update on their testing efforts. I did want to say two things. I completely skipped attendance. So really quickly, I'm going to go through our attendance roster. Please, committee members, just acknowledge that you're on the meeting. Alfred Grant.
Grant here.
Thank you. Michelle Gonzalez. Michelle Gonzalez. Helene Wilson. Helene Wilson. Emmanuel Asamoah.
Yes, I'm here. Helene Wilson. Sorry,
Thanks,
I couldn't
Helene.
get my mic on.
No worries. Thank you. Emmanuel Asamoah. Daisy Perry. Daisy Perry. And Chad Royer.
Chad Royer is here.
Thank you. Perfect. Thanks so much, folks. And I also wanted to acknowledge that after our presentation from North Central, we are going to have a presentation from Orisha Wellness. And Miss Shelley Wilson is here and will be able to give us some updates on her end. So thank you, and I apologize for not acknowledging that. And with that, Alfred, yes, you have a question?
Yeah, just one question for Mr. Johnson. We're going into the spring and summer times, and does it look like that there will be an increase for awareness about the vaccines, where to go and take these shots and things like that? Because as I'm sitting here, I also have turned off my Channel 7 News, and it seems like cases seem to be rising.
Thank you for that question. So yes, cases are rising. A lot of what we've been working on lately at the health department is encouraging people to get their boosters. As a city, we're actually doing quite well in terms of the vaccination rates. Citywide, we're at about nearly 80% for people that have received the people that are fully vaccinated. However, a lot of these people were vaccinated months ago, right? So as I talked about earlier, the waning immunity, they might not be as protected as they were when they first received their initial doses, which is part of the reason why we continue to encourage people to get their boosters, and if you're eligible, to receive a second booster. So in short, yes, that is absolutely messaging that will be forthcoming in the near future.
Just one more add in. I do know that at one time it was mandatory, so they took the mandation back off. Do you think they will put it back on in terms of taking the booster or the fourth round of booster shots?
To be honest, I can't say whether or not that's something that's going to happen. I don't think that, as I said before, we're not an enforcement agency. We're not trying to force anyone to do something they don't want to do. We're simply here to just provide everyone with as many resources as we can so they can make the best informed decision for themselves. Obviously, we're encouraging people to get vaccinated and boosted, and wear masks and protect themselves. And that's what we will continue to do.
Thank you. Thank you so much, Kenneth. Thank you, Alfred. And so we will move along in our agenda. I will ask the folks from North Central if they're ready. Thank you so much for joining us tonight. We have with us today Dr. Ngozi Nwangpa. Did I butchered that, right? Can you please correct me?
You did a pretty good job. You did a pretty good job. It's Ngozi Nwangpa. You did a pretty good job.
Okay, well, thank you so much for joining us. And she's the vice chair and director of quality within the Department of Obstetrics and Gynecology. And she, along with Ms. Denise Wharton, are going to provide a brief presentation on North Central's Bronx Women's Health Services. We're also joined by Keisha Giles. And Keisha, also please correct me if I mispronounced your name. Who's the Director of Public Relations at North Central. And of course, we see Mr. Alfredo Jones also on the line. Really grateful to have the whole team on board. So thank you so much. And however, whichever order you'd like to go, you're more than welcome.
Okay, fantastic. We do have a presentation from Women's Health. So I guess we'll go ahead and go first. I want to thank you, Michelle Avila, for inviting us and for that wonderful introduction. It is really our pleasure to connect with the community any way that we can. And we really see this as a partnership. We deliver services for the community, and the way that we could ensure that we're delivering on that and making sure that we're meeting the expectations of the community is by having partnerships with people like yourselves, Community Board 7. So as Michelle mentioned, I am the Director of Women's Health Services at North Central Bronx, and along with me is our Director of Midwifery. And so we want to share with you two things that I really want to leave you with today regarding the services that the Women's Health Department delivers at North Central Bronx. The first is our midwifery care. So Denise Wharton is going to talk to you about that, about the midwifery care. And the other is GYN services. So I'm going to, close out the presentation with that. So for the next several minutes, we will, hopefully be able to provide some very useful information that you can help spread in the community regarding what we're doing at North Central Bronx. So I'm going to pass it over to you, Denise.
Hi, my name is Denise Wharton. I am, as Dr. Wampa said, the Director of Midwifery here at North Central Bronx. I have been here since I was a baby midwife in 2008. So I've been here about 21 years now, and it has been such an honor. I am a Bronx resident myself, so I love working and delivering the people of my community. I think it's great. And one of the fun things that I have been here, what I've seen over the past 21 years is how the community has changed and different groups come in and out. And it's really just been wonderful. What makes us so special, I think there's a couple of different things. One, we are one of the largest midwifery services and also one of the oldest midwifery services in New York City. We are 45 years old. When this service was started, it was really different because usually midwives are seen as, home birth, out of hospital, very private practice type of care. And when Therese Dendero started our service here in this 1970, 76, 77, somewhere around there, she really saw a vision of where midwives could be practicing in the hospital, and that patients who were more high risk did not deserve midwifery care. So we learned how to combine midwifery care and more high risk care to be able to give this type of care to patients. So I absolutely adore that when I come to work, when I'm taking care of a patient who is, say, has elevated blood pressure issues or diabetics, they don't automatically become no longer mine. But we work together in conjunction with the physicians so that we can really, the midwives get to really focus on the parts of the pregnancy that are still normal, while the docs work with us to really manage the medical aspect. And I think that is really something unique that a lot of places aren't able to give. We have patients, we have like docs that are, we have recently delivered a doc from Mount Sinai who came to us because we actually delivered twins. She wanted midwives delivering her baby because where she was from, midwives deliver, and she wanted to have midwifery care to be able to deliver her twins. So that was something that Like, I just love so much about our community. And I love that I saw in the chat that we have a 1990s NCB baby. And the other day I was online for a restaurant, skirt steak, you know, it's all over TikTok, it was actually very good. And the woman behind me was delivered by my friend May Chin, and she was 30 something years old. And we were chatting because we were online for an hour and a half. So it's just, we're everywhere. And I just love meeting people that have been delivered, and we deliver generations. I'm now a grandma midwife. I have delivered a baby I delivered, which I found to be one of like the greatest joys. So other things that we do, given our, which I think are special to us, is that we do collaborative care. Collaborative care is a program through social work and psychiatry that will really focuses on women with having who have depression and anxiety. So we really stress on looking at the woman as a whole, not just her medical issues. We also have something called the maternal home care program, which they help us they go through all the social determinants of patients, making sure that they have all of the things that they need. They're kind of like a buffer between the providers and social work, because we're both a little bit overwhelmed. So the maternal care really finds out what is it that these women need to make sure that they have enough for their baby. They also help, if they're interested in doula care, we also help them get free doulas through maternal home. So that's really been wonderful. We also do something called co-location or mother-baby clinic. One of the things that we notice is that moms really, we all know that women tend to take care of themselves when they're pregnant, right? It's really hard sometimes to get women to come in to just take care of themselves. So once they deliver their baby, sometimes they don't come back to their postpartum visit. So what we did is we moved a midwife to peds, right? Because women will come and bring their baby back. So once they come back to bring their baby, we have the midwife there to like capture them and actually do their visit on the pediatric floor to make sure that they are getting their birth control, to make sure that we are making sure that their blood pressure is taken, so that we can really continue their care into what we call the fourth trimester. That fourth trimester is so often overlooked by people. And so we work so hard on making sure that the woman has all that information during pregnancy. And once a baby comes out, that's really the hardest time. And we felt like sometimes this can be lost a little bit. So we've developed different programs, such as the mother baby program. And we have a new program that's starting that really focuses on the fourth trimester care, where we're getting blood pressure cuffs for patients. We're going to be doing a phone call 2 weeks after they deliver, so that we can make sure that their blood pressure is still okay, that if they need breastfeeding services, we can get them breastfeeding services, that if they do need something that Steffi, our maternal care person, can do, she will do that. We've also really established a lot of ties within the community. So within the community, we have been working with the Bronx Borough President, Vanessa Gibson. Myself and one of our midwives are on the committee to help with maternal morbidity and mortality. And also, one thing that I'm really super proud of is we've joined up with a group called LAL. I don't know if you know LAL, but they're the Bengali women's group. Sanjana is one of the women who is running that. And we've developed a program it's called A Comprehensive Guide to Increasing Dialogue about Sexual and Reproductive Health for the Bengali women. So starting next Monday, we're going to be having 25 women in our hospital every week and for 10 weeks. And we're going to be teaching them all about different parts of their body. We're going to talk about preconception counseling to hopefully decrease risks of diabetes during pregnancy. We're going to talk about sexual health, how to have a good sex life, how to be contracepted. And I can't even tell you how excited I am about this program. And it was really nice. I was actually recently asked to be on the board of LAL. So now I'm going to be also even more connected to this community. And again, we do childbirth education in conjunction with Jacobi, because Jacobi is our sister hospital. So we really try to make sure that if there's ever reason for a transfer back and forth, that we all know each other and that the patients feel comfortable with that transition. And one of the things that I'm also pretty proud of is what we've done with the home birth midwives for their home birth collaboration. We've worked on this on a couple of different levels. One, we've been available for MD consults. So if there's a patient that it becomes a little bit more high risk, patients have either switched to us or just have gotten consults. We've been able to open our sonogram to these patients as well. That way they become comfortable with the hospital. That way, if there is a reason for transfer, that transfer becomes more comfortable. We've really worked on having a smooth transition from home birth, because it is a decision that some women will make. And sometimes it's the right decision. Sometimes they should really, they need to transfer to the hospital, and that's okay. And we're here for them. So that way they don't feel that there's an antagonistic kind of transfer. So we want to feel that there's such a good community between the midwives and docs here at NCB as well as the home birth midwifery, because it really is all about choice. And we do honor patients' choices and just make sure that we give them all the correct information. That way they can make that choice. But, and I'm going to hand it over to Dr. Wampa. And then thank you again so much for having us. I really appreciate this.
Okay, great. Thank you so much, Denise, for sharing with this community what we're doing at North Central Bronx and the passion that we have when it comes to delivering on quality care that allows patients to enjoy the support of having a midwife, at the same time being able to manage their pregnancy if it's complicated, and still being able to keep them within the community of practice that we have at North Central Bronx. The other thing that I really wanted to highlight is our GYN care. When we think about disparities, and which is one of the things that is so great about having midwifery care at North Central Bronx, especially when we're talking about things like maternal mortality, and some of the higher higher rates of morbidity that you see inside the community. The support that we create around that becomes critical for our communities that sometimes don't have access to certain things. And complex GYN care, especially when you're talking about minimally invasive GYN surgery, is sometimes there is still that disparity in terms of being able to access this type of service and this level of intervention in underserved communities, in city hospitals, and public systems. And so I apologize with the little screaming in the back. That's my son downstairs. But when it comes to GYN complex care, we're putting together a specialty clinic so that patients who have specific issues, such as abnormal bleeding, which is a common problem that women face, fibroid uterus, about 80% of women of color will have to deal with fibroids by the age of 50. So that's a common problem. And even for Caucasian women, 70% by the age of 50. So, this is something that a lot of women are faced with. Chronic pelvic pain, urinary incontinence and leakage, which is something that women face. However, sometimes it's not something that's easy to talk about and share. So it doesn't easily sometimes come up and visit. Pelvic organ prolapse, where sometimes, once you become older and the muscles that support your pelvic floor become weak, sometimes women start to have different symptoms. And I'll just share with you, those organs that come through the pelvic floor are your bladder, your vagina, and your bowel, your colon. So those come through the pelvic floor. And as the muscle gets weak, people sometimes start to have different issues with either the bladder falling low, the pelvic organs, the vagina or uterus falling low, even issues with bowel incontinence or difficulty passing stool. And so at North Central Bronx, we have minimally invasive GYN surgeons, as well as a urogynecologist that can address these issues. And it's something that I want to put out there because it's not always at people's fingertips. Sometimes people don't realize the, higher level of subspecialties that are available right within the community. And these things are available at North Central Bronx. And so I just want to, so we're just sharing that with you. You could go to the next slide because we're wrapping up at this time. And so I really just want to open up the floor for any questions or any thoughts that you want to share with us. If there's a way that you want us to see us show up in the community more or connect or participate, just like the gentleman from the DOH said, letting us know whatever events are available so we could be a part of that. That's something we definitely want to do. One thing I do want to say before any questions, I know that there were questions about COVID testing. And at North Central Bronx, we do have on the first floor of the building and also sometimes outside in a van, there is the opportunity to test. The rapid PCR test is available at North Central Bronx and it is open to the community. So this is also another resource for people who need testing locally and need rapid testing, PCR testing locally as well. I'm just going to put my email in the chat, and Denise, if you could put yours as well. So please do invite us to any community events, or, you heard Denise talk about the law community that a lot of us are working with. And so we would be more than happy to, do something similar and replicate that elsewhere.
Thank you both so much. This has been a really informative presentation. I think my first question, and really piggybacking off of your last statement, is how can we help you amplify? So I know we have family and friends in the community. What is the best way for them to seek out care, especially for those issues that might be a little more delicate or that folks might be a little hesitant because of either cultural or linguistic barriers to seek out care?
So of course, we are open to all. So patients could definitely make appointments. We have, face-to-face visits. We have virtual visits. We have televisits in which we could connect with patients. Our specialists also use these platforms to take care of patients as well. So I will make sure that you have access to how people can call, make appointments, and reach out to us so that, we could help to address whatever issues they have. Denise, would you add anything to that?
We also have a community coordinator, Luz Ortiz, who, if you know any particular clinics in the neighborhood that are looking to send patients, because maybe they don't do OB or maybe they don't do more complex GYN, Luz Ortiz, which I could put the number in the chat, she is the coordinator for those clinics, that she's able to hook them up with Epic Care, and that way we can have a good communication back and forth between the community.
Thank you so much. Are there any questions from members of the committee or community board members?
And I just love that. I think there was 2 of you guys that we delivered here. I love that. Like, that makes me so happy.
Awesome. Well, thank you both. Oh, I'm sorry. Any questions from members of the public?
I have a question. I was wondering, has the maternal morbidity rate declined since the program has been on the way? I asked that question because I know it's high, and I just wanted to know, has there been a decline?
Across the city, the thing about maternal mortality, is that you're counting in, over, over 100,000 people in terms of that rate. So it takes a while sometimes before you start to see that decline. What we're aiming to do really is to, we know that for women of color, that our rates are 3 to 4 times higher than, people who are not women of color. And what we're aiming to do is to really kind of create support so that hopefully, as in the future, as we're looking at these numbers, that we start to see that decline that we're looking for.
And one of the things I think it's so important is that we are talking about it a lot. It's not something that we are sweeping under the carpet and pretending that it's not happening. We just recently celebrated Black Maternal Care Week, and all of the all the OBs were wearing Black Moms Matter, and it just sparked conversations. And I think that's what's most important, that our patients know that they can ask us anything, that their voice matters. And I think that is one of the most important steps, is for patients to know that we're going to listen to them, that we're definitely going to listen to them.
Thank you.
Thank you. Are there any other questions? Thank you so much. We will reach out and let you know about any events or opportunities for collaboration. We're having a community resource fair on June 23rd, so we will be sure to send you the details, and we would welcome flyers, tabling, anything that we can do to help spread the word about these services. And we'll be sure, as individuals and community leaders, to also pass the word along about the host of services that you all have in both OB and GYN. So thank you so much. We really appreciate your time today.
Thank you so much.
Thank you. Thank you so much. And Keisha, I know you had said hello in the chat, but if you wanted to unmute yourself and introduce yourself, please feel free.
Absolutely. Thank you again, Michelle. Good evening, everyone. I apologize that I don't have my camera on, but I'm Keisha Gill. I am new to the team at Jacoby NCB. I'm the Director for Communications, Public Affairs, and Community Relations. I am, like I said, I'm new to the team, but I'm very excited to collaborate with CB7 to engage the Bronx community to share health resources and information. And like I said, like you mentioned, I did place our Facebook social media handle in the chat. So I encourage you all to follow us on Facebook so that you can stay up to date with the latest information that's going on at the hospital, and also to get information about different health issues. We'll be sharing information to engage the Bronx community to promote health literacy. So please follow us on Facebook. And again, thanks for having us. Thank you.
Thank you, Keisha. We're so happy that you are on board. Welcome, welcome. And we look forward to working with you over the next couple of months. Again, wanted to say thank you to all of our colleagues that joined us today from North Central. We really appreciate your time and your presence here, and you are all more than welcome to stay on the call, of course. But just wanted to see if there was anyone that wanted to add in any last words here on the North Central front. Awesome. Okay, so we're gonna move into our, Alfred, go ahead, Alfred.
No, I just want to thank everybody from North Central for coming, and I hope you keep coming back, because I don't think of us as being adversaries to Montefiore, but we are North Central. We are forced to be reckoned to. And the thing is that, you know, the thing with these children and the epidemics and things like that, there needs to be more communications with the neighborhood, and tell them, keep coming to North Central.
Thank you so much. I wholeheartedly agree. That was great.
Thank you so much, Alfred. We appreciate you. We don't have favorites, but we love uplifting our New York City H&H hospitals. You all did so much during the pandemic and really are known for just having your doors open to anyone, regardless of immigration status. So like all of those other things. So we appreciate it. And it is really, really great to have this venue to learn about your services so that, again, we can share the information and hopefully connect more folks to care. So we appreciate it. Alfredo, I see your hand up. You want to unmute yourself?
Hello and good evening, everyone. I wanted to take a moment to actually just kind of respond quickly to Alfred, one of our consummate advocates and cheerleaders. So I appreciate that. Openly welcome Keisha Gill to our team. She's going to be an amazing addition, and she will be part of the reason you will help see and hear of us more often, and also to Dr. Wampa and Denise, who are pushing one of the services that we here at North Central Bronx believe is kind of the diamond in the rough, but it's going to get polished under this leadership. One thing I did want to also say to Alfred, thanks to Michelle and Community Board 7, we will have this platform. We were assured to have kind of reoccurring role in this movie, and we appreciate you folks. I'm not sure if this was an opportunity in the past, but we really, really appreciate it now and moving forward. Thanks.
Thanks so much. Okay, so we will move right along to our next presentation. Shelly Wilson from Orisha Wholeness. You could please unmute yourself. Thanks so much for your patience.
Oh, good evening. Can everyone hear me okay? Okay, good. I'm sorry, I'm standing outside. But I do want to thank the board for inviting us to speak today. Orisha Wholeness is a very new 501c3 organization, nonprofit organization. And what we do is we provide health and we promote health and wellness to the community. We're based in the Bronx and in Westchester. And the way we do this is by offering free fitness classes. We do health and wellness events. And we offer financial literacy workshops as well as nutrition workshops. And a lot of our events, are based in Poe Park. So we're investing in that community. The majority of the board members are from the Bronx, and we're having an event this Saturday, May 21st. So we wanted to invite the board and also let you know about it. So it's a health and wellness event, and it's in partnership with the Poe Park Visitor Center. So Kathy Mitchell is involved, and we have a full day full of free fitness events for the family as well as the children. So it starts off from 10 to 11 a.m. with a community walk. So we have a 2-mile walk from Poe Park up the concourse down to the reservoir and back around the Poe Park. And through that walk, we're going to talk about a couple of historical places in the Bronx. Just some fun facts during the walk. And we know it's going to be 90 degrees, so it's not going to be so many facts. But we want to keep people moving. And then when we come back, that's when our fair begins. So we have different fitness workshops for all levels, as well as I said, the children's zone. We're also in partnership with Bronx East, and they're going to be doing a free healthy food demo. We have the fire department coming. So what we like to do is when we provide our events is we like to partner with local organizations in the Bronx. So I know this is our first year, so we're really trying to get our name known and actually find people to partnership with us. Because as I said before, our events are free or very low cost. And as of right now, they're free. So everything is open to the community. We look for people to partner with because we know how important it is to bring health and wellness to the community. Like I'm rushing here, I'm a fitness instructor as well. So I'm standing here and I have to teach a cycling class in about 15 minutes, which is why I'm in the vestibule. So I'm sorry about that. But yeah, so we're really excited about this event. It's one of our biggest. We said before, we're only a year old and we think we've done a lot and we've made a lot of contributions, especially in that Poe Park area. If you ever drive by, or walk by, you might see our line dance and social every third Sunday of the month, or our free fitness classes 4 times a week. And like I said before, it's open to communities. We're really invested, and we would love for the board to come, help support us in any way, or just bring people to the event. And I will drop my the website down in the chat. If you have any questions, please let me know.
Thanks so much, Shelley. We really appreciate you taking the time to hop on, especially before starting a class. Let me just see, does any committee members, anyone on the board have questions? Jean, go ahead.
Hi, Shelley, just quickly, because I know you have to run. Do you cover all the way up to seniors or only up to a certain age range?
We're open to everybody, all levels. We have a large population of seniors, especially in our line dancing classes and all fitness levels. Our classes are catered to all levels.
So the date that you're having this first event that you're having at Poe Park, what day is that going to be?
It's this Saturday, the 21st, and it's from 10 to 4 p.m. From 10 a.m. to 11 a.m. is our community walk. So we also have Bronx Soul helping us to lead the walk. So it's going to be a walk that everyone can do in all paces. We'll have, the fast walkers, the moderates, and the people who are like, hey, I just want to stretch my legs. So everyone will have an opportunity to walk and then come back and enjoy the festivities. That'll go from 11 to 4 p.m.
And then after that, you say you have classes every third Sunday?
Yes, we have line dancing classes. It's every third Sunday of the month, and it's in Poe Park. But we also have classes every Saturday. So there's a different class every Saturday. The second Saturday, we do our monthly walk to different areas in the neighborhood. Then the third Saturday, we have a salsa, we have a Zumba class, and we have total body fitness. So what I'll do is I'll drop the website down, and all of our classes is listed, all of the information you need, all of if you need to register, it's on our website.
Okay, thank you. I appreciate that.
I'll put my email too, so you can always email me directly.
Thanks so much, Shelley. And I got the flyer from Jade for Saturday's event, and I also just put in your website in the chat. So we'll be sure to circulate that as well. And we'll also ask the board to send out the flyer so that folks are aware of it.
We appreciate that. And I'll also put my email down. So if anyone has any questions and you want to email me directly.
Thank you. And we absolutely look forward to partnering with you in the near future, especially during the summer. So you will definitely be hearing from us.
Oh, that's perfect. We have a lot of plans for the summer, so we're looking for partners.
Wonderful. Are there any other questions or comments from general members of the community? Awesome. Thank you so much, Shelley. Appreciate you, and good luck with your class tonight.
Thank you. Bye-bye, everyone.
Bye-bye. Thank you. All right, folks. So just going back to our agenda really quickly, we will check to see if we have anyone from Montefiore on the line. Anyone from the Department for the Aging? Anyone from the Mayor's Office of Immigrant Affairs? Okay, before we go into new business, Jean, I see your hand up. Please feel free to unmute yourself.
No, I meant to put it down, sorry.
Oh, not a problem, Jean. Thank you. So the only item that I wanted to add again is thinking about what our presence as a committee will be during the summer. I know that we are just kind of getting back to whatever kind of normal this is. And so wanted to ask committee members and board members and even members of the community if anyone has ideas for specific things that they might be interested in doing over the summer, whether that's tabling. I know in previous committee discussions, we've heard from folks like John Sherman who said, hey, you know, we can partner up and we can get you masks or you know, swag so that we're out in the community, we're offering something and linking it to kind of resources that are out and available into the community. So wanted to start that conversation tonight, and we can absolutely follow up over email.
Absolutely, and we're always available for anybody, you know, who needs our services and assistance. Just let us know.
Thank you, John. Any ideas from committee members or board members? Go ahead, Jane.
Michelle?
Yeah.
My
Yes,
computer
ma'am?
froze. I missed what you just said. Any ideas on?
Sure. So summer outreach opportunities, you know, tabling, just things for the committee to get back out in the community, and also link it to some of the resources and services that we've heard about this year.
Oh, I actually do. Suicide awareness.
Thank you.
That's one idea.
Perfect. Thank you so much. Jean, go ahead. I saw you have your hand up.
No, in the summertime, there are a lot of outside events that pop up. And I think we should always have a presence to give out health information, the information they gave out today about the midwifery. CB7 was one of the boards that really championed them having that program at North Central Bronx when they really had wanted at one point to even try to close the hospital down, which has needed resources for the people of this community. So we fought hard with NCB to make sure that that resource was there for the women of the community. But there are always events that come on, the National Night Out, other events that come up, that we should have a presence there to always be promoting health, women's issues, particularly now women's issues, you know, with what's going on, and also men's issues, because one of the things that don't get covered enough and men are reluctant to even talk about their own health issues is something that I plan to do here at the building, where we're going to have it a men on men conversation and talk about prostate cancer, colon cancer, tests that men should be having from the age of in their 40s and up, that sometimes they wait too late to have, and that could be a death knell for them. So we want to put that information out there for men also. So
it's a great point, Jane. Thank you. I'm taking notes. I'm seeing in the chat, Mashulu and Oval are great locations. Agree with you, AJ. Agree. Okay. Thank you, Jean. And I see Toby, you have your hand up. Please unmute yourself.
Yes, I wanted to see, I am a member of Friends of DeVoe Park, and I wanted to see if it's possible, maybe one day during the summer, and we will hammer out with more strategically later, if we can do tabling in the park to address um some of the things that we discussed here, particularly mental health concerns, um, uh, literacy concerns, do some possibly COVID testing, giving out some free things, and even perhaps if we can, um, um, there's another program I know that distributes free food. So I would like to see if Friends of DeVoe Park can work with Community Board 7 to get that done
Thanks so much, Toby.
in the summer.
Yeah, that's a great idea. I'm going to put my email in the chat so that we can connect directly. I'm also going to bring up that idea during our executive committee meeting this week. So thank you. Hopefully let's connect so that we can nail down a date and then get other folks on board.
Okay, thank you.
Thank you. Anyone else? Ideas, thoughts?
Yeah.
Okay. Go ahead, Alfred.
One of the things is that I know individuals don't like to talk about, but in this community, along Jerome Avenue, we have a large population of there used to be, I call it, there used to be FEGS program. They turned it into a homeless shelter, and that homeless shelter has the capacity to hold 200 beds. And Gene, I think you can back me up on this. As we walk through Jerome Avenue, the amount of individuals who look like they may be from FEGS seems to be throughout the whole street of Jerome Avenue. And I think there needs to be some sort of lookout for the Department of Health for these individuals that need help. And the summertime is coming, so we're near the park. Mashula Parkway has a lot of trees and things where individuals will sleep in the park overnight. And I mean, you have to see it to hear what I'm saying is the truth in terms of they need help. And so we should be the ones that call out for the Department of Health, maybe Thrive New York or whatever, that these individuals need help.
Alfred, I appreciate your comments, and I absolutely want to lift that up. I will bring it up at the executive committee meeting as well, but I think you're right. We need to be thinking about summer planning, and we know that there are certain kind of activities that happen during the summer that we should just be aware of, both in terms of quality of life, but also in terms of health. And I appreciate you naming this as a public health issue. You know, there's a lot of stigma around folks, and we don't want to do that, right? We understand that individuals come from all walks of life, and, you know, they can be facing a multitude of issues. So we want to make sure that we're connecting them to services. At the same time, we want to hold the city agencies, providers responsible and make sure that they're also doing their part in keeping our communities healthy and safe and whole. So I just want to say thank you for lifting that up. And it's something that I think we should have a deeper conversation with as a board as well, because, you know, these are not overnight problems. They didn't happen. They didn't come to be yesterday, and it's going to take all of us working together to really address them in a comprehensive way. Thank you. Jean, I see you have your hand up. Please go ahead and unmute yourself.
I hate to be so chatty over here.
No, we love it.
But the FEGS building, which is 3600 Jerome Avenue, is something else that Community Board 7 fought for. Originally, they wanted to put the homeless shelter on Webster Avenue across the street from an elementary school. And it's actually right next to the 52nd precinct. And that was a big fight in the community. We were able to, with the help of a lot of our elected officials, Andy Cohen, Mark Jonai, other elected officials, Natalia Fernandez, we were able to get them to switch it from in front of that men's homeless shelter, it's a men's homeless shelter, over to Jerome Avenue. The problem now, as Alfred is, saying, is now they're wandering up and down Jerome Avenue and also into the shopping areas. And I think we need to like revisit it again to see what services that might help to boost up things that they might need there. We haven't really kind of gone back to it, since they opened the shelter. Then the shelter got closed during the pandemic. Then they've since reopened the shelter. So yes, I do think it's something that we need to like kind of go back, say, do you guys need something else? See what city agencies we can help, go in there, help them out, because anybody could be homeless on the street. Okay. So yes, we want to give them as much help as we possibly can. It's not, we're trying to put anybody down. We're just trying to lift everybody up.
Appreciate that, Jean. I agree with you 100%. I plan to bring this up at Thursday's executive committee meeting, and I know we have just one more month before we adjourn, but I also know that this board works during the summer. And I know our district manager is great about convening folks and getting city agencies all together. So I do think that this is something that we should absolutely bring up and work towards during the next couple of weeks, but certainly during the summer as kind of things open up and, we go full swing underway. So appreciate the comments from you both here. Okay. Is there anyone else that wants to add anything? New business?
Oh, can you hear me?
Yes, Chad, go ahead.
I couldn't tell you if you saw my hand. So just two ideas, vastly different from each other. I don't know if the opportunity presents itself if we can do some type of awareness for our individuals who are special needs. A lot of them can benefit from getting evaluations and services so that they can be in the right setting for schools and therapies and such. I go through this firsthand because I'm a father of a child who has a disability called autism, and I'm very passionate about that. The other thing is that upon submitting a request through sanitation or parks, I realized that when rats dig holes in the ground and you call 311, it's the Department of Health that answers the call. I've been seeing a lot of them on the streets, in the tree pits, in the ground, under the sidewalk. And what they do is when you call 311 and the Department of Health answers, what they tend to do is try to find where the holes are and set the baits. So I'm wondering if this is something that we can take a look at as far as a public service, especially now that, number one, the summertime is coming. Number two, more people are going to be outside and they're going to be careless with the garbage. Number three, they're not going to know what are the proper ways of mitigating the rat issues. And number four, there actually are programs that can teach the public at large ways to keep rats at bay so that they don't multiply as much. So I bring this to you, and I should have emailed this to you earlier, but life happened. Maybe this is something that we can look at. Oh, it was called Rat Academy. They probably still have some, you know about that?
Yeah, I think Councilmember Dinowitz actually just held one a few weeks ago, and we shared some of that information. I think you're right, Chad. I'm thinking about Cirio Guarino, who was always the advocate for rats. Let's get this rat presence out. Yes, this has come up several times over the past couple of months. And, it's really important that we document this and document the presence so that we could get the Department of Health to come in and do everything that you just said. So I think this is something else we should add to the executive committee meeting, maybe as a board, setting up a system where, we can see if folks are calling the district office, if we can follow up on those kinds of complaints, at least to identify the areas where there's like a large rat presence, because it is going to get worse during the summer. So appreciate that. And yeah, I think it's something we should absolutely discuss on Thursday.
It'll be my pleasure to do so.
Thank you. Kenneth, were you unmuting yourself?
Yes, yeah, I was just going to say to facilitate any kind of presentations or anything from our pest control team. So obviously, you know, as you said, as it gets warmer, this is going to be a more increasing problem. So, you know, and of course, once you submit the 311 request, you know, feel free to let us know if it's not taken care of in a timely manner. I can help expedite the process. So just want to share that as well.
Thanks, Kenneth. We'll definitely take you up on that and appreciate you assisting and following up to share resources. I think we might want to do something targeted with both the community board and maybe something over Zoom so that we can reach our neighbors and encourage them to do those 311 complaints, because I know that that's really how it gets monitored and addressed in the quickest kind of way possible. Awesome. Well, thank you so much, everyone. This has been really generative. We kind of went through our whole agenda. Our next meeting is June 21st. We already have a few presenters on the agenda for next month. And so just want to give folks a heads up that next month is going to be a really full meeting. Invite everyone to absolutely send me any ideas or things that come up via email. But really appreciate everyone being here tonight and making this such a great meeting. Thank you so much. AJ, I see your question. We're actually, that's on the agenda for our executive committee meeting as well. I think folks are talking about whether we'll be returning in person or not. And, you know, it's interesting because I think that the Zoom format works really well to get out information. I know that this is going to be live streamed on YouTube. And so folks that didn't have the time to do that today, to see it today, can then watch it after the fact and see the wonderful presentations. I think in person, we lose some of that, but we will absolutely be talking about it and discussing it and trying to figure out what the best format is to move forward. We'll keep y'all posted. We'll see. We'll see. I don't even want to think about the legal implications. So we'll see, more to come, but I will absolutely keep folks posted. And again, really invite you all to come to June meetings. Awesome. Can I have a motion to adjourn?
Helene Wilson, motions to adjourn.
I second that. Thanks, Chad. Thanks, everyone. Have a great night.
Good night.
Thank you.
Good night, all. Great meeting, Michelle.
Have a good night.
Hi, everyone.
Thank you
Good
all.
night.
Really appreciate you.